You know, you could not have told the difference between a doctor and the maintenance staff, and the matron and a maintenance staff. They were all at the service of the people and at the service of our country in the difficult times. And I think the future of the health services and the future of our country will certainly be well served by that kind of attitude, that kind of commitment, and that demonstration of the true Dominican spirit, especially at this time. I also want to thank the international community, the international health community, PAHO, WHO, who've been here, you know, literally from day one, assisting us, guiding us, accessing much needed resources. Of course, the Permanent Secretary will list and point out the number of agencies, countries, individuals who've assisted us, who've been assisting us in responding to the health challenges. But I believe when one takes everything into consideration, where we were on the night of Monday and the morning of Tuesday, and where we are now, and of course the professionals will indicate that, you know, it is nothing short of heroic. Heroism coming out of a real passion and dedication. There are doctors who have had to walk miles to get to the PMH. There are nurses who had to walk miles over trees and fallen poles and electrical wires and cable, landslides, mudslides, leaving their homes unattended, making their way to the hospital and to the health clinics to provide care to the people. So on behalf of the people of Dominica and the residents, I really want to thank you profoundly and profusely for your dedication to our country and our people. We continue to soldier on. We are clearing the roads. One can drive in almost every street in the city now, though they have lots of debris on the side, but that will be cleared in the next days and weeks. But one can drive in almost every street in Roseau, in the city. We're restoring water to our people as quickly as possible. We're trucking water to some communities, bulk water, bottled water, supplies. We are improving in telecommunication. One can make a telephone call to Portsmouth now with the help of some French officials, some French people who've set up a satellite in Portsmouth, so one can receive calls in Portsmouth, make texts, receive texts, send SMS, BBM to Portsmouth, and improving the telecommunication services. I could have made, and I'm making telephone calls from the fixed line in my office, and we can also start sending fax messages to across the world. So we get in there. This is no way back to normal, but certainly we're on the way to that long journey. And as the Chinese say, you know, every journey begins with the first step, and we have made some first steps, and we're journeying on. So we'll continue to fight. We continue to engage people. We will be launching a program officially. It has been started, but we launched officially a cash for pay, a cash for work program, where people across the country will be engaged in clearing and rebuilding, and those persons will be paid on a weekly basis for their work. The intention is to engage everybody. I have the Ministry of Education out in the field doing assessments of schools, and with the intention of commencing classes the soonest, so that our children can go and play and not think of the horrible experiences of Hurricane Maria. I will leave you, the viewing and listening public, in the capable hands of the very hard-working and committed Permanent Secretary, Mr. Later, who is also of the EOC and who's been really exceptional in his duties and his commitment to his country. So I leave it in his capable hands, and I really wanted to be here to thank all of you for your efforts. No check can compensate you for your work, and there are no words in the dictionary currently. We may have to create words to express how profoundly grateful we are as a people. And in time, when the good Lord returns to get us, I'm sure you'll be appropriately compensated for your efforts on earth. And that's the ultimate compensation which we all strive to attain. It's a very narrow road, but we're traveling that road nonetheless. So thank you very much, and thanks to the media for carrying these messages to our people. We have to have hope, we have to be positive, we have to be constructive, and I believe that with the help of God and with our commitment to work and to nation and to the absolute support of the international regional communities, we shall rise again. Thank you very much. Yes?
Thank you, PM, and let me say good morning to all our listeners. As PM indicated, this morning we are focusing on health. We have with us a very distinguished group, but before I introduce the group, like the Honorable Prime Minister, I would just like to express my sincerest thanks. You know, words really cannot express how we feel about the response of health thus far. The health EOC has been operational from day one. We were struck on Monday, and on Tuesday we grouped at the hospital irrespective of the condition and had to ensure that services as best as possible were provided to the Dominican public. So I really want to single out the health professionals, the doctors, the nurses, the ancillary staff, the maintenance unit. I think of Mr. Fontaine, and all of them, all who have supported environmental health, whether you were at the hospital or in the district, but ensured that our nation, the health of our nation, was looked after. This morning we have Dr. Johnson, the Chief Medical Officer, with us. We also have Dr. Ruby Blanc, who is the Hospital Medical Director. We have our PAHO representative, Clement Butter. He was here with us of Tropical Storm Erica in his capacity as lead of the Dutch mission to Dominica then. Now he is heading the PAHO group in Dominica, so we are very happy to have Clemens with us again, and he will give us some a contribution from PAHO in terms of how PAHO has responded to our situation. Dr. Esprit, who has been roaming the country despite the difficult terrain, the difficult roads, to look at what's happening at the district level. Dr. Benjamin, who will speak about psychosocial support and his response, the response of his team thus far. And of course, you would have heard Mr. Senville, our acting Chief Environmental Health Officer. And this morning, he will bring us up to date what's happening in terms of our water quality, waste management, vector control, and other issues that you may want to have answers on as it relates to environmental health. As the Honorable Prime Minister indicated, the task is a very large one. It's a humongous task that we have. I mean, we are bombarded with calls every minute of the day. Persons have to be evacuated, persons need medication, persons need just psychosocial support. So, you know, it has been tremendous, but like we say, we will rise, and we have risen to the occasion. So I'm going to invite Dr. Johnson now to sort of give a brief overview of the situation in terms of how the health sector has been impacted and what are the current challenges and how we proceed to move from there. Dr. Johnson.
Thank you very much, P.S. Slater. Good morning to the other members of staff of the Ministry of Health who are here for us today. And good morning to the listening public of DBS Radio, both in Dominica and far and wide. I want to thank the Honorable Prime Minister for this opportunity which he has given Health for this press conference, and thank the Permanent Secretary in the Ministry of Health for his leadership which he has shown. Before I start, I also want to join others in expressing my condolences to families and friends who have lost ones at this difficult time. It's very difficult for all of us at this time, very emotional for all of us at this time. Immediately following Hurricane Maria, I really felt daunted, I must say. I wonder if we could ever rebuild this country, but a few days ago, something within me told me and keep telling me that yes, we can, and I honestly do believe that we will rebuild Dominica back. I think we are definitely a resilient person, and given the strong leadership and determination of all of us in Dominica, I'm convinced that we can rebuild this country back again. I am totally convinced. At least something inside me keeps saying that to me. I must express, like the Permanent Secretary and the Honorable Prime Minister, profound gratitude to all categories of healthcare workers who bravery, risking lives, actually never stop working, taking care of patients. During the actual passage of Hurricane Maria, there was staff, when roofs were flying out from some sectors of the hospital, there was staff actually moving patients from one area to the other. Some of those staffs have never stopped working from Sunday night to today. Through their heroic efforts, not a single patient, and I repeat, through the heroic effort of those staff, and I refer to all categories of staff, doctors, nurses, pharmacists, cleaners, wardies, through their heroic effort, not a single patient who was at the Princess Margaret Hospital at the time of the passage of Hurricane David lost their life. So no one who was actually a patient at the hospital lost their life during the passage of Hurricane Maria. I'm also pleased to report that, to the best of my knowledge, no healthcare provider lost his or her life as a result of Hurricane Maria. To the best of my knowledge, no healthcare provider actually lost their life during the actual passage and to date from Hurricane Maria. The main hospital, and Dr. Black, our hospital medical director, will speak to details in terms of how the hospital is operating. But just to say, the main hospital in Dominica, our Princess Margaret Hospital, although it was significantly impacted by hurricane, continues to function. Our primary healthcare director will speak in details of as to what is going on in the primary healthcare sector, but our district medical officers and other healthcare staff continue to provide healthcare services at all of our major type 3 health centers all over the island. However, we are still, and Dr. S will speak to the details of that, trying to make contact and assess the functionality of some of our small health centers. To the best of my knowledge, all of the type 3 health centers are accessible, except for Granby at this time accessible by road. The Health Emergency Operations Center has been activated, as Permanent Secretary said, from Tuesday, and have been meeting daily at the conference room of the Ministry of the Princess Margaret Hospital. At that Health EOC, that is Health Emergency Operating Center, we meet as all senior managers together with our regional partners, CAFA, PAHO, who provide strategic guidance for us. That meeting is normally chaired on a daily basis either by the Permanent Secretary, the Chief Medical Officer, the Hospital Medical Director, or any other senior manager of the Ministry of Health. In terms of, some of the things that we really discuss at this meeting is looking at the situation on a daily basis as it relates to the critical needs of the hospital, primary health care, what goes on in environmental health, health promotion, surveillance and disease, which I will focus on a little more before I finish, the human resource needs, and deployment of staff from the different countries and organizations here. In terms of patient care, to the best of my knowledge and for the records that we have so far, for the patients who have been brought in at all of our healthcare facility, only one patient lost his or her life as a direct result. 2 patients as a result of Hurricane Maria. That is patients who have been actually brought into the hospital or to healthcare facilities. And that speaks to the tremendous and heroic effort of the staff, of all of the staff of the Princess Margaret Hospital and throughout the entire primary healthcare district. We want to keep the death as a result of Hurricane Maria to the minimal, and therefore at this time some of our key function, our key focus I should say, is trying to minimize death as a result of gastroenteritis, and I'll speak a little more with regards to that, leptospirosis, dengue, and tetanus. In terms of gastroenteritis, and I will leave some details for the environmental health officer, we know, for instance, at this time it's extremely difficult to get drinking water. We know that all of our water supplies have been affected, and there's a tendency that persons will be drinking water from whatever source that they think is clean. We want to emphasize that you should not drink water whether it's from a source, whether it's from a river at this time, except the water has been treated. And Mr. Senville will speak to detail of how that can be treated. We know at this time that persons also, the water is limited, and therefore we want to encourage persons and to emphasize that you should try to wash your hands as far as possible or to sanitize it before eating, because we do not want to lose any more life as a result of any other disease resulting from the passage of Hurricane Maria. A number of our patients, well, today is raining, but generally it has been very dry since the passage of Maria, and therefore we expect to get a lot more patients suffering from who have chronic lung problems to be presented at our healthcare facilities. We want to encourage all of our asthmatic and all of our patients who have chronic lung problem that they should stay away from the dust or use some sort of mask as far as possible. We also want to encourage these patients that they should not get into contact with any sort of burning garbage which might have plastic, styrofoams, or any sort of fumes at this time. Leptospirosis is going to be a major challenge for us because homes have been destroyed, there's dirty water all over the place, rats have been infecting a number of those waters all over the place, and therefore we want to encourage persons that they should not be trying to get in or should not be in contact with any dirty water at this time, because whether it's at your home, whether it's on the street, therefore we have a lot of rats over the place, and urine of the rats carry the leptospirosis germ. And we want to encourage persons that they should use gloves at this time and to ensure that they do not walk around barefooted. We are very concerned with regards to tetanus. We are extremely concerned with regards to tetanus. A number of persons have bruises because of either through metals, nails, or any sort of thing that they got into contact with. And therefore, because the bacteria is out there, we want to encourage persons that they should not get into contact or avoid contact if they have any bruises or any cuts on the skin with dirty water at this time. Dengue is going to be another significant challenge for us. We have the Aedes aegypti mosquito here in Dominica. A number of our water sources have been exposed at this time, and persons have been storing water in any sort of containers that they can get, and we expect that the breeding of mosquitoes, the Aedes aegypti mosquito, is going to rise, and therefore persons must take all necessary measures to ensure that they limit the breeding of those mosquitoes and ensure that at least some of the water drums or tanks they have around the premises are kept covered as far as possible, and to avoid the bites of mosquitoes. At this time, I will pause and hand over to Dr. Blah, who will speak in more details in terms of what is actually transpiring at the hospital, or what has transpired at the hospital, and what is actually taking place there as we speak. Dr. Blah, our hospital medical director.
Good morning, everybody. I would like to begin by also adding my voice to the condolences that have been extended to all who lost family, loved ones, friends as a result of the passage of the hurricane. I would also like to extend my thoughts and concerns, which are actually shared, to all those who lost property, homes, roofs as a result of the storm. I too would also like to say thank you to all levels of healthcare staff, but I must single out those who provided service during the storm and in the immediate days and hours following the storm. Many persons, especially from the hospital where I can speak best about, had no idea of the status of their homes, of their families, and yet they remained and they provided quality care to the patients who were there and who were coming into the institution for care. Your commitment is a ray of hope that if we continue to work together, we can rebuild Dominica, no matter how bad the situation looks right now. So your commitment is greatly, greatly appreciated by all of us. I also would like to say thank you to all the support staff or the support agencies, both local and external, and both individuals and agencies who have assisted us so greatly up to this point in time. We have seen about 500 patients at the hospital, and that is patients coming in through accident and emergency since the passage of Hurricane Maria. And the majority of those patients, especially in the early days, were patients coming in with injuries and complaints related directly to the effects of the hurricane. We had broken bones, cuts, lacerations, joint dislocations, numerous nail pricks, falls, head injuries, number of infected wounds, asthma, eye injuries. And as the days are passing, we're seeing now more patients coming in with chronic illnesses like the high blood pressure and diabetes that are not controlled due to medications being lost, medications having gotten wet, or just the conditions worsening because of the stress of the situation that we currently face right now. As was mentioned, the hospital did receive a major hit during the hurricane. There are a number of places that were damaged and destroyed. And as part of our plan, we had housed the majority of our patients in the Francisca Dorival complex during the hurricane, and we also had a few patients on the Emory ward. And for those of you who know the arrangement of the hospital, that is the downstairs male medical ward. So of course, services have been interrupted, and I will go through now where we currently are in terms of service provision. For our surgical services, we're only doing emergencies, life-saving, dire emergency surgeries right now. We're not doing the elective surgeries, and we would hope to resume that when things return to a greater degree of normal. We were severely limited initially by the shortage of water and electricity, but that has improved, and we are hoping that in terms of at least doing the emergency surgeries, that will be done with a little more ease. Our oxygen plant was also damaged and is currently non-functional, so that is still a bit of a handicap for us. But we're also working with our international partners to get oxygen brought into the island, so that too will be taken care of. And at the same time, we are feverishly seeking the parts that we need to restore the oxygen plant to full functionality. The male and female medical wards are still in the Francisca Dorival, the male and female surgical wards are still in the Francisca Dorival complex. But as early as today, we're hoping to begin to move them out of this area, and we will be moving them to parts of the hospital that have already been repaired or are more suitable for their housing at this point in time. Our dialysis unit was another area that was affected, but we're happy to report that 10 out of the 11 machines are functional, and thanks very much to the hard work of the WASCO, the return of the water is allowing us to resume fairly normal dialysis services. The internal medicine wards, well, they're all housed, all patients are housed on the Emery ward, which is the downstairs floor, because the Glover ward also was damaged. We had roof damage, and we would have to repair that before the patients are moved back upstairs. The obstetrics and gynecology department, we have both postnatal and antenatal, that is patients who've delivered their babies and patients who are still pregnant, all on the antenatal portion of the ward for the time being. The nursery, the special care nursery, is also being housed in that part of the hospital because the nursery itself received damage in its original location. The delivery rooms are functional, and yes, we have had babies being born since the passage of the storm. Our ICU, the original location was also destroyed, so the ICU is now located on the Winston ward as well. And Winston ward, the children ward, remains where it was. In terms of X-ray or radiological services, we can do X-rays, we can do ultrasounds. We are not yet able to do CT scans. We're in the process of cleaning the area and reviewing of the machines, but we will need to bring in our usual maintenance partners from outside of Dominica to ensure that all is okay with the machine before we can resume that service. Our lab also got a hit, and currently we do not have lab services. But again, that hopefully will be rectified in a very short space of time. The machines, as of yesterday, were being turned on and being tested to ensure that they are functional. And we are hoping that very soon, hopefully in another day or two, if possible, we will be able to resume even the most basic of lab services. We evacuated 17 patients to the Dominica Republic and 2 patients to Martinique. As of yesterday, there were another 2 patients pending evacuations, and we're continuing to work to make that a reality. I must stop here and say thank you to our PAHO colleagues, to our colleagues in the Dominican Republic, and to Martinique, who have been so great in providing assistance, getting those patients out of Dominica and receiving them for further care. The evacuated patients had a wide range of complaints or reasons why they had to be evacuated, and the medical conditions for which they were evacuated included head trauma, serious infections, fractures, and other uncontrolled medical conditions. And as Dr. Johnson reported, we had only 2 deaths recorded at the hospital that were related directly to the storm, and those were patients who were brought in after the passage of the hurricane. And the first patient was a case of gangrene, very serious, and the second patient was one who received a head injury. Every day we're continuing to resume or move towards as normal functioning as possible. Areas are continued to be cleaned, machines are continued to be checked, repairs are continuing on damaged portions of the hospital. And so usually at the end of the day, we have a service that we didn't have at the beginning of the day. And I really again must commend all of the staff, and in this area the maintenance staff, for the almost beyond human effort that they are making to ensure that the hospital goes back to as normal as possible in the shortest space of time. We continue to work with our numerous donors, and as I said, those are both within Dominica and outside, and they are both individuals and organizations to access both supplies and equipment as the need arises. So at this point, I will hand over to Dr. Esprit, who is the Director of Primary Healthcare Services.
Good morning to the Honorable Prime Minister, members of the Health EOC, members of the Ministry of Health, PAHO representative, the media, a listening public, Dominicans. Let me start off by saying condolences to the families who have lost their loved ones and to those whose families are still missing. Again, condolences to the wider community, since we all have been impacted in one way or another by Hurricane Maria. Primary healthcare services is a very critical arm of the Ministry of Health. As a matter of fact, it is the model of healthcare that is practiced in the Commonwealth of Dominica, for persons who didn't know. As the Director of Primary Healthcare Services, it is factual to report that the passage of Hurricane Maria has impacted significantly on primary healthcare services. By this, I refer to the following: infrastructure, accessibility, human resource or staffing, timeliness of delivery of supplies, among others. These all have impacted the quality of services rendered directly after the storm. For the last few days, a team comprising of the Senior Community Health Nurse Acting, that is Odette Theophile, the Project Officer in the Ministry of Health, Mrs. Marilyn Morris, and myself, the Director of Primary Healthcare Services, we visited the different health centers in some of the health districts, primarily the areas that we had access to, namely St. Joseph, Portsmouth, Margot, and Castle Bruce. In the following days, as road access improves, plans are to visit Granby and other vulnerable areas of Roseau. And of course, attempts will be made to get across to La Plaine. Sadly, while touring the country, we couldn't even recognize some of the health centers due to the devastation of first the route to get there and of course the facility. To me, Dominica was unrecognizable. The objective of the visit were as follows. 1, to make a quick access of the facility, looking at the infrastructure, the generators, the water from the water tanks, among others. To assess the pharmacomedical supplies that were available at the district level, to discuss possible deaths with the teams, to deliver water to staff, and of course, last but not least, to motivate and encourage staff. Generally speaking, from an HR point of view, the majority of staff have reported to work. Staff have been working tirelessly, and not just after Maria, but prior to Maria. If you recall, there's a disaster preparedness efforts that must be made, and staff was engaged with that prior to Maria and immediately post Maria to provide care to all. The majority of the staff has reported losing their own homes and personal belongings, but that has not been a deterrent in responding to the health needs of the community. Speaking from my own standpoint, from day one, I opened the Maho Health Center to provide care to the persons who needed it, visited the shelters again to provide care, and my home became a health center. So I know the first-hand experience of staff across primary healthcare services. In areas where the health centers has been affected, infrastructurally that is, or where access is challenged, some of the nurses are working from their own homes, providing care. Gradually, adjustments are being made in the district to start and continue what we call comprehensive clinics. It would be remiss of me at this point not to mention the collaborative approach of the district police officers, the fire officers, the district disaster committees, and other community groups who provided support to the health administrative team in one way or another. You know, for example, the police, when the teams have shortage of fuel for the generators, the police tend to either give theirs or share it with them. So again, we're very thankful for that collaborative approach. From an infrastructure standpoint, we can report that every facility has in one way or another been affected. That is the 49 health centers on island. The majority has been flooded. By that I mean supplies have been damaged, have become wet, unusable, and of course this has contributed to the temporary delays in the commencement of service delivery. We can report that the majority of the 7 Type 3 health centers, though, across the 7 health districts, the Type 3 health centers are the bigger health centers, they are functional, which means that from the quick assessment that was done, there were minimal infrastructural damages sustained, and that's from our preliminary assessment. In case of La Plaine, this facility was transferred to a retrofitted building prior to Maria. However, the roof was reported to be damaged, and the staff is operating at the Jones Beaupierre Primary School. In the case of Marigot, prior to Hurricane Maria, the A&E department was transferred to the Wesley Health Center. That's where it was established for the last few months. And with the exception of blown out doors and windows, the A&E department remains functional. As it relates to Grand Bay Health Center, it remains inaccessible by road. However, it is reported that staff or services are in operation at the health center. Unfortunately, some of the Type 1 health centers have sustained considerable damage, and some are considered to be out of commission. The Woodford Hill Health Center, Dodan Health Center, Pichelin, Dubla, we spoke about La Plaine, Warner, and Bellevue-Chopin thus far. Additionally, a common echo of some of the staff at the Type 3 facility is the need for security for staff and of course the supplies at the facility at this time. And they've started making arrangements to engage community members to pose as security officers in the interim. As it relates to medical supplies, since the passage of Hurricane Maria, pharmacomedical supplies have been sent to all the Type 3 health centers at the 7 health districts via air, sea, and land. As road access becomes better, more will be sent, and of course more often. And of course the district pharmacists will make their requisites for any special items that the specific health districts may require. So it suffices to say that there are no health districts at this time without basic supplies. It has been noted that there has been an increase in supplies sent to the districts from the CMS standpoint, and of course particularly from the Roseau Health Center. We have increase in supplies of antibiotics, wound care supplies such as dressing packs, sutures, cleaning agents, gloves, etc. Medication for patients suffering from chronic diseases were also packaged and submitted or delivered. Some of the concerns that we have: outbreaks of tetanus, leptospirosis, gastroenteritis, asthma, increase in NCDs, and of course the mental health stressors, both among staff and the citizens. There has been significant psychosocial devastation, inclusive of our staff in primary health care. We also recognize that there is a need to improve surveillance of communicable and communicable diseases across the 7 health districts and of course the health centers. And additionally, we notice that there is an increase in demand of services on staff, primarily as it relates to increased lacerations, wounds, and uncontrolled chronic diseases at the district level. These are some of the challenges that we have at present. As persons are cleaning, possibly walking without shoes. They sustain wound injuries and require more wound care. And dressing parks at this time are limited. But the Ministry of Health is working along with donor agencies as well as PAHO to address this concern. Due to the fact that there is no electricity, the cold chain of some of the vaccines have been broken, primarily that of tetanus toxoid. This is a very important vaccine, especially due to the fact that persons are sustaining, as I mentioned, wounds from galvanized, rusty nails, metals, etc. And what we did, the mobile team who went out with me over the last few days, we had a flask with tetanus toxoid, and we went across health centers delivering as much as we can, but of course in flasks. Another challenge of limited fuel at the district level. The generators at the Type 3 health centers can only operate during some critical hours and not throughout the 24-hour cycle, bearing in mind there is no electricity for an unknown period of time. Plans are ongoing to deliver drums of fuel, particularly to the Type 3 health centers, for continued operation of the generators. Due to the water being taken or stolen from some of the tanks at the health centers, in the absence of the WASCO water, cleanup and services offered have also been delayed. With this constraint, staff has gone over and beyond to give the facility a semblance of normalcy. Some of our staff have been working pre-Maria and are exhausted. They are psychologically affected, and plans are ongoing by the Ministry of Health to give them some respite with some of the support of our professional volunteer aides on the island. Due to the severe damage of some of the Type 1 health centers, which are the smaller health centers, especially those that are deemed out of commission, the plans by the Ministry of Health would be to review with a strategic eye, setting up temporary units with the support of the volunteer and donor agencies, or have mobile units to the most affected areas. Lastly, I just want to commend, really deeply thank staff of primary healthcare services, the nurses, the doctors, the team leaders, auxiliary staff, pharmacists, all categories of staff for their passion, their resilience, their commitment, dedication to delivering health services to Dominicans despite their personal losses and struggles. Thank you to the district partners, to include the fire, the police, community groups. Thank you to the donor agencies and volunteers. And thank you to the team who went out with me to visit thus far most of the 7 health districts. Thank you so much. I now invite Mr. Sylvester Senville, Acting Chief Environmental Health Officer, to the podium.
Thank you, Dr. Esprit. First of all, let me extend my sympathies to all those who have been affected by Hurricane Maria. As you know, environmental health services play a critical role in ensuring that diseases and conditions are not transmitted post any disaster. Disasters normally affect the life supporting systems which support the population. That includes the water, clean air, safe housing, sanitation, pests and the land. These disasters tend to affect those in severe ways, and Hurricane Maria appeared to have affected them more severely. Dr. Johnson has spoken quite a bit about some of the areas that were affected and what is expected to be done, but environmental health response is geared at reducing threats, and the threats which could lead to disease from environmental factors. We do this by conducting assessments, conducting damage assessments, shelter assessments, water quality monitoring, healthcare facility assessments, solid waste monitoring, conducting health education, and collaboration with the number of partners which are presently on island to ensure that some environmental health services are provided and conditions are alleviated. We are particularly concerned about the water quality. All of our water systems have been affected. Some of our water systems, DOASCO, have been working feverishly to restore them. WA1, Water Area 1, which is the water service which provides to most of the island, well, most of the Roseau Health District, is being restored. Some of the communities already have water returned. This water is still not treated, so we would advise people to boil that water. Please do not, we also advise that you do not use bleach in the water, because usage of bleach has to be done by an expert. You might add too much or too little, which may not treat the water properly or create severe problems in the future. Environmental health officers have divided into groups, and we are working in each health district except that of Granby because of access, issues of access. We have 5 officers located in Marigot Health District, 5 officers in Portsmouth Health District, 3 officers in St. Joseph Health District, 2 in Cassibus, and 5 in Roseau. These officers on a daily basis conduct monitoring of environmental factors and environmental conditions which have been affected, and they report back, and this report is feeded into the Health Emergency Operating Center. So far, we've monitored 52 shelters, not those which were previously identified as sheltered as the official shelter list, but those which became shelters after the storm, because many of the shelters were damaged and individuals could not have accessed these shelters because of roof damage and water damage as a result. These shelters, we've been monitoring the sanitation, the water quality, water availability, food availability, and other health-related issues, which are then transmitted to the health team, who are able to undertake measures to alleviate the plight of the individuals at the shelters. We are also very concerned about the air quality. Today is a better day for the air quality, because we got some rain last night and the early hours of this morning. We are very concerned that the air quality could be deteriorated as a result. There's an increase in burning of fires, and there's a lot of dust in some of the communities because of sediments which have settled on the streets. And as vehicles traverse, they cause the air to migrate, and then it contaminates the air. So we are advising, and Dr. Johnson also mentioned the issues of air quality, because chronic lung disease and issues of long-term lung disease could result as a result of the poor air quality occurring in some of the areas. Environmental health also has concern about this management of waste and waste disposal. We've worked with Solid Waste Management Authority to develop a plan for management of waste in Dominica. This plan includes identification of sites in the communities where galvanized and metal sheets could be placed. For example, in Roseau, the Pottersville Savannah and the Savannah across the Pentecostal Church in Goodwill have been identified for placement of galvanized sheets and wood, not household garbage. Household garbage will be collected by the Solid Waste Management Authority upon completion of an assessment and repair of the road to the landfill. So we are hoping by today some of the waste of the household garbage in Roseau could be collected and brought to the landfill. In Stock Farm, the waste, the galvanized and wood should be brought to the old landfill site. Mind you, after all the waste has been collected, the Solid Waste Management Corporation will be receiving some crushers where we'll crush this galvanized and remove them. Some people might think, well, it may be unsightly, so the galvanized will be removed and we are hoping that people who produce charcoal can use some of the wood for production of charcoal in the future. For pests, we've been meeting with the National Pest and Termite Company to devise a strategy. We've already developed that strategy for management of pests, especially that of flies, rodents, and mosquitoes in the city. Today, on Tuesday, an assessment was done of mosquito breeding sites from Loubier to Pottersville. Sites have been identified, and today the National Pest and Termite Company will be moving to do some treatment of those sites. There will also be treatment of the garbage heaps, which is a breeding ground for flies, and when the garbage is removed and placed at the landfill, a rodent baiting program will be undertaken. We already have the rodenticide for the rodent baiting program, particularly in the city area. Water, we have some concerns that all surface water is contaminated. If you collect water from a river, from a stream, from a drain, anywhere, the water is contaminated. Assume that it is contaminated. Our land is bare, no land cover, so we had some rainfall and water will run off into the streams and rivers. The water is very turbid. That means there are sediments in the water that causing it to have a cloudy color. These sediments can attract, or microorganisms or bacteria can live on those sediments, and if you consume that water, it is likely that you might be affected and get a diarrheal disease. So we do not want anybody to get diarrheal diseases. We've been advising on how we can treat water. So do not assume that the water is safe. The water is not safe. Even the water from the Doasco tap, which has returned, cannot be considered safe yet because treatment is not being conducted on the water. There are some rivers, particularly, we need to reiterate that the Roseau River is not fit for bathing, drinking, or washing. Roseau River below Silver Lake. We've done some assessment on the Roseau River and found that numerous wastewater disposal systems along the river were affected and washed, and they have been washed away, and sewer lines are emptying into the Roseau River. Sewer lines from Emsall, Bath Estate, and in Roseau are emptying in the Roseau River, so we are advising against the use of the Roseau River for any activity whatsoever. Roseau River below Silver Lake, it should not be used for any activity. It is very important that people pay attention because the conditions existing in the river can lead to a number of communicable diseases, and we do not want anybody suffering from communicable disease. We want you to ensure that you protect yourself and you protect your health. The Poitrong River has turned black, and then we are presently undertaking an assessment to ascertain the reason why it has turned black. Most likely it's chemically related, and up the Poitrong River there was a previous dump which may have eroded, and the sediments got into the river, which has turned it black. So by the end of today we should complete an assessment to ascertain whether what would be the cause of the discoloration of the water in the river. We are working with our partners from PAHO and the WASH team. There's a WASH team, Water and Sanitation team in Dominica, from PAHO, Red Cross, UNICEF, Samaritan Plus. These teams are looking to see whether they could assist some of the communities with water treatment facilities. This morning I had a discussion with the Red Cross, and we're identifying 3 communities, Colio, Dubla, and Coolibistri, where rivers are being used for every activity, including sewage disposal, to see whether they could install some temporary water treatment plants in these 3 communities. They've decided that yes, we're going to look at Dubla first and Coolibistri and Colio after, because they are presently procuring water treatment plants which could be placed in each of the communities. These communities are vulnerable because they are densely populated and they have been severely affected by the storm. So we are hoping that by the end of the day we should be able to install one of the water treatment plants in Dublin especially, and we will move to Coliho and Colibistri in a not too distant future. Water has begun to return in some of the communities. We have Roseau, Portsmouth and environs, Cochrane. There's water flowing in the taps. The water is mainly for sanitation purposes, and we hope that individuals could boil water for drinking. I've also distributed about 60,000 aqua tabs. These tabs were donated by the Pan American Health Organization. These tabs are to be used in clean water. We advise individuals, if the water is turbid, to pass the water through a sieve or a clean cloth and then use the aqua tabs. The aqua tabs that we at the Environmental Health Division are giving is 1 to a gallon of water, not less. Do not use them in the bottled water, and do not fill up the bottles that you've used and put an aqua tab in the bottle. You need to use it to 1 aqua tab to a gallon. We are also trying to standardize the aqua tabs that are being given by the number of agencies, because we have quite a bit of aqua tabs for water purification that are given by the donors and the international agencies which are here in Dominica. We are also trying to standardize, because some of them are not used, not just one for 1 gallon, but sometimes you have 1 for 2 gallons and 1 for 3 gallons. So we are working with the various teams to ensure that there is standardization in the aqua tabs that are given. We had a meeting yesterday, and that we discussed that issue, and we are hoping that we could get to the standardization of the aqua tab distribution by the end of today. Well, thank you very much for your patience and assistance. I now introduce Dr. Griffin Benjamin, the psychiatrist.
Pleasant good morning to my colleagues, our Permanent Secretary, Mr. Davis Later, and my other colleagues, Dr. Johnson, Dr. Blah, Dr. Esprit, Mr. Saintville. Good morning to all Dominicans. Hurricane Maria visited Dominica about 10 days ago, and life as we knew it suffered what we call a serious battering. We know that it caused massive destruction, and it is evident by the fact that so many people lost their lives. The family life as we know it is somewhat disrupted. I could say severely disrupted. Now, the physical spaces of our homes was destroyed by the fierce winds and heavy rain and the rushing water with boulders and mudslides. As was highlighted by the PS, the CMO, the directors, and actually Mr. Saintville, the Senior Environmental Health Officer, we are still facing a major disaster here in Dominica. It continues to be a major disaster for 2 fundamental reasons. One, this storm, this hurricane, has overwhelmed our natural ability to cope. It has overwhelmed our ability as Dominicans to cope with life as we know it. Secondly, we need help, we need assistance in order for us to overcome and re-establish the life that we once knew. Of course, it is much easier to appreciate the physical loss of lives and the destruction of property that is totally visible to anyone who's seeing. However, it is not always so easy to measure and understand the psychological impact and even the social problems that this hurricane has caused us here in Dominica. From my observation, I think Dominicans are coping fairly well at this time. My task as the psychiatrist, as one of the psychiatrists, with our community mental health team is not an easy one. Our work begins now And I must say, we expect and we predict that it will get worse before it begins to get better. Let me, on behalf of the Ministry of Health, inform the Dominican public that we have accepted an offer from 12 mental health specialists. We call them the trauma specialist team from Trinidad and Tobago, who have offered to join us in our response to this disaster. So the government of Dominica and the government of Trinidad and Tobago are working to bring over these 12 persons. After Erica, 8 of these persons were in Dominica, and they were of tremendous value to the Dominican population, particularly those specific areas that were affected by Tropical Storm Erica. So what is the real psychosocial impact of Hurricane Maria on Dominica? If we were to look around, we will see that 10 days after this hurricane, many of us are still a bit confused and shocked by the damages we witnessed. Yes, we are all suffering, but many of us are so badly impacted that we just do not know where to start or where to begin the process of recovering our lives. Eventually, all of us want to move away from the nightmare experiences that we had, but this is not easy. We expect frustration to creep in, and this will bring with it a sense of hopelessness, a feeling of hopelessness and helplessness. This is a very dangerous kind of situation for all of us. We must allow negative feelings, or we must not allow negative feelings to overcome us. We need to guard our minds against those negative feelings. It is easy to give in, but that will not get us anywhere. Our country will bounce back and we will overcome. We have done this before and we will do it again. Let me say at this time that I admire profoundly in the recent days some pronouncements made by some of the school principals who are mobilizing parents and teachers to clean up and start school at the soonest. I also admire the businesses and the corporate bodies who are pushing to recover their businesses and get Dominica started again. Let me at this time especially thank all the workers at the psychiatric unit for their commitment to duty even when most of our staff suffered heavy losses. Our staff showed up for work immediately after the storm, and we have put our system more or less back in order. I hold with utmost respect the Princess Margaret Hospital nursing, medical and support staff as I witnessed the heroic teamwork demonstrated during and after this wicked hurricane. Matron White should be singled out, and the nursing team worked like a well-functional machine, and the matron was only able to be demobilized yesterday to check up on her own house building that was severely damaged. The Ministry of Health, through the Community Mental Health Team, is making all preparations and has already made attempts to provide psychological and social support to all Dominicans. The response for this hurricane disaster is not an easy process or response. We were all affected. The mental health team is still pulling its resources persons together 10 days after the storm. Communication is not flowing as we would like, and we are still preparing. On Monday, the day of the storm, we invited 100 or more psychological first aiders to join the district health teams around the island in their respective communities to respond after the hurricane, to provide emergency psychological first aid and victims and survivors that were affected. The conditions of work are not ideal, but over the last 10 days, our team has held debriefing and supportive sessions with many of the first responders. Now, we need to extend ourselves to the rest of Dominica. Here's what we are doing now, starting from this weekend. Community meetings, we have scheduled community meetings for the worst hit areas, and again we have not yet defined, as we did in Erica, what are the critical areas, because the entire country was hit. But our plan is to encourage community leaders to organize these meetings, and we will make ourselves available to work alongside other disaster workers and guide a better understanding of human reactions and behaviors after any storm. For media communication, we have spoken on the radio alongside persons sending out solidarity messages to families and friends. If we look carefully at the tone of the messages over the past days, we would have observed that they are shifting towards complaints and demands for more immediate, basic social support. Our people expect us to organize ourselves. We have also scheduled a media communication program on our campaign where mental health professionals will be assigned the duties to cover the media with information that could improve the coping abilities of all Dominicans at this time. For Dr. Esprit, we'll make mental health services available at the health center for persons suffering with stress, anxiety, depression, and all other psychological emergencies. We want to make ourselves available to the vulnerable, particularly the elderly, the children, and of course the mentally ill. A strategy that worked for us in Tropical Storm Erica was the training of part-time mental health disaster workers. We speak here of pastors and other clergy members, media persons, shelter managers, and others. Finally, let me remind Dominicans that at this critical time, we need to work together and we need to embrace the help that we are receiving from everyone inside and outside of Dominica. Again, I want to repeat, we have sought, or we are getting support from Trinidad. I've been getting calls from other psychologists and social workers who want to join our efforts in Dominica. It's going to be a big effort, and through our PS, we will try to organize how we accept this help. But let us work together. We need the energy that we are spending right now. We need to conserve this energy so we can use our minds properly to reconstruct our lives. I wish Dominicans well, and we shall work together to improve the life. I now call on the Permanent Secretary as he summarizes this meeting.
Thank you, Dr. Benji, and let me thank my colleagues from the Ministry of Health for this very informative hour, 15 minutes that we've had thus far. From day one, we have had a number of our partners in health working alongside with us at the Princess Margaret Hospital and in the wider Ministry of Health. And I would just like to recognize some of this support before I call on our main partner from PAHO to come and make a contribution. We've had from the Queen Elizabeth Hospital in Barbados, we've had 4 nurses. We've had from the Martinique group, we've had some doctors and nurses. From Trinidad, we've had a group of doctors and nurses. They are providing service at the Goodwill Parish Hall. We've also had 4 nurses from Anguilla. We've had another 3 doctors from Martinique, the SAMU team. From Barbados, we also had 2 doctors from the Queen Elizabeth Hospital, A&E doctors. We had a number of doctors from Venezuela, I think about 12 of them. We've had 10 doctors from Cuba, one of our strong allies in health. That includes family practitioners, family doctors, orthopedic surgeon, epidemiologist, and 1 intensivist care specialist. We've also had doctors from Guyana. We had 9. From Holland, we had 10. And also from Palestine, we had about 11 doctors from day one from Palestine who have been providing support to us. We are very grateful for this contribution from our friends, our partners in the region and internationally, but we also need assistance, HR assistance in other areas. In our maintenance section, we need electrical technicians, we need biomedical engineers, we need electricians, we need carpenters, we need handymen. Even it does not have to come from overseas. We have locals who have those skills. We ask that you join us at the Princess Margaret Hospital to continue the rehabilitation work. We also need cleaners. So if those of you listening to me this morning and you're available, you have some time, you can devote some of this time to clean some of the health centers, hospitals, etc. In the kitchen, we need help with cooking. We need cooking staff. So if you have those skills and available, you can contact us at the Princess Margaret Hospital. We require environmental health specialists. We require also health educators. We still require nurses because, as Dr. Esprit indicated, our nurses have been at it from even before Tropical Storm Erica. We need to be able to provide respite for them. So if we have retired nurses in Dominica who can give us a day or two, or we have nurses, Dominican nurses overseas who would wish to come and give a couple weeks, we welcome that. We also require medical officers, pharmacists, and also persons who can assist us with medical supplies in terms of distribution and other logistics. At this point, I'm going to invite the PAHO lead person in Dominica, Clemens Butter, to say a few words on behalf of PAHO. But before I call him, I just want to recognize the tremendous support PAHO has been providing to us at the Health EOC. The direction that PAHO has given to us, it has been really tremendous. So let me invite Clement Butter to contribute.
Good morning, everybody, especially the citizens of Dominica, of course, and all the people of the Health EOC. My name is Clemens Buter, and I'm the team leader of the Pan American Health Organization team of 7 people currently on Dominica. But first of all, I would like to express my sincere condolences to those who have lost a loved one in this hurricane, and to the people, of course, in Dominica affected. I would like to also bring the special thoughts and prayer of our director of the Pan American Health Organization, Dr. Carice Etienne, who, of course, as a daughter of your country, is especially concerned about the impact of this devastating hurricane on Dominica, your lives and livelihood. The Pan American Health Organization, through our team of 7 experts on the ground, with support of PAHO, but also with support of many other organizations, are here too. We are here to cooperate with national authorities in carrying out rapid damage and needs assessments in the health sector, in order to coordinate the health response of all international agencies. We evaluate the health information and assess potential public health risks for the population. We provide direct support to the Ministry of Health to ensure that the delivery of healthcare services, water and sanitation, and other public health resources to all affected population. And finally, we are coordinating international assistance related to the health sector. Like the Prime Minister, I really finally would like to express my sincere appreciation for all other international partners who are all here in support of Dominica. I would especially like to thank the Royal Netherlands Navy for all the logistic support we as PAHO also received from them. We already heard yesterday about the Dutch ship the Zealand, but I would also like to mention the Pelican. This ship was here already in 2015 after Tropical Storm Erica, and was during the last few days able to transfer vast amounts of supplies from many organizations, including PAHO, from Antigua to Dominica. We look forward to continued collaboration with all international partners in supporting the government of Dominica to overcome the effects of this hurricane. I wish you all well. Thank you.
Thank you, Clement, and we would like to extend our thanks to PAHO, and would like you to extend thanks to Dr. Shreb, our Regional Director, and also to our own Dominican Dr. Carice Etienne, PAHO Director, for the support that we continue to receive from PAHO. PAHO, as I said, has been one of our strongest partners in health. I would also like to recognize the contribution, the support that we have received from the International Red Cross as well as the Samaritan Purse as other allies that we have been collaborating with in the area of healthcare. We've been with you for some time now. It's almost an hour and a half that we've been at it, and I'm sure you may have some questions of clarification, some point of clarification. I don't know that you'll have many questions because I'm sure we would have probably answered all the questions you had from all what we've said this morning. But if there are any burning questions from the press, we are prepared to take it at this point in time.
Nestor Philip here. I would of course like to know the number of confirmed dead, confirmed missing, and unconfirmed missing, and also where is the list of the names, if you will, and the photos of these people to alert their families and the general public, because many people have been asking on both Dominica and overseas about their families reconfirmed dead, number of confirmed missing and unconfirmed missing.
Well, that information, though, I think that that rests with the police, that you would be able to get that from the EOC, from the officer assigned from police at the EOC. Unfortunately, we can only give you figures of the death that we've recorded at the Princess Margaret Hospital, and Dr. Blanc did report on that, and those that were reported from the health centers.
For Dr. David Johnson, Chief Medical Officer, he mentioned don't drink water from the source. What is the ministry doing to help people access water purification tablets? Up to yesterday, I tried to assist 20 people, but I didn't know who to go to, no matter who I spoke to downstairs. There was no assistance, so essentially no water purification tablets received, but I hear the acting Chief Environmental Health Officer talk about 60,000 aqua tabs. Could you update us on where can people access water purification tablets?
Okay, thank you very much for that question. I think, as you recognize, distribution of supplies is a bit challenging, but what we are trying to do, and hopefully during the next day, by today or by tomorrow, those water purification tablets will be sent to the different health centers through the environmental officers, and also through the environmental health department here in Roseau. So we're making arrangements to have all of these water purification tablets distributed through the communities, through the health centers, through the environmental officers that are within the communities. And they'll be going around within the communities to distribute those water purification tablets. We know it's taking a little time, but given the challenge that we have in terms of communication and distribution.
Priska Julian, GIS. Dr. Benjamin spoke about the training of persons to assist, to support with the mental team. I'm wondering, is it definitely going to happen for this storm? And as well, what is the process? Can people come forward, or are you seeking out people to assist with supporting the team?
It is a standard procedure. The World Health Organization has a manual which we used for Tropical Storm Erica, and we brought in groups of persons who we know are leaders in community, like the clergy, pastors. The media personalities are very important in that. Once they understand the concepts related to disaster, they are more likely to communicate to the general public this information. So yeah, we had planned to start the training since yesterday. I'm going up now to meet some of my staff who are waiting for us to continue what we did yesterday, continue some more, and we bring in people as the days go along. So the training will happen at the occupational therapy building at Princess Margaret Hospital, and we're inviting everyone who wants to work with us. We call them temporary disaster workers, mental health disaster workers, and it's it kind of increased the number of persons reaching out to people. So yes, we invite the media to join us, and we will send letters out. I don't know how we communicate. I don't know the means of communication right now, but we'll have to do by word of mouth or send Vital out to get people in. Radio announcements and bring people in. But we are starting training, so you'll find tomorrow we'll have a formal training tomorrow for sure. But my staff are being trained as I speak to you right now.
I have some questions for Dr. Ruby Black, Hospital Medical Director. Can you bring us up to speed on how soon the oxygen plants will be restored, and how soon are your international partners bringing in the oxygen supplies? Is it this afternoon, tonight, this morning as we speak?
I cannot give you an exact time frame. We're actually going from here into the Health EOC meeting, and hopefully we will have an update at this point in time. Our Trinidad partners have been given all of the specifications for the parts, and we are hoping that we can have some positive feedback at the meeting today that we have received the parts. And we also, as I said at the meeting, should receive some update as to when the oxygen supply, the tanks, would be coming in. So we're working on both fronts. So whichever one happens first in terms of getting the tanks in or getting the plant functional, we're working on both fronts so that we have a ready available supply of oxygen. Okay. As we speak, works are continuing on the on both areas. Yesterday, they were in the process of trying to recover the roof of the intensive care unit, and they hopefully will get next to the maternity unit. But the important thing is that those services exist. Although they are not in their original location, it doesn't mean that we don't have ICU capabilities. You know, God forbid we have to provide ICU level care to somebody at this moment. We are in a position to do that. Okay, so although they're not in their original locations, we can provide those services, both maternity and ICU services.
Dr. Blah, thank you so much for your time. I have a question as regards the road and baiting program to the Chief Medical Officer. Is that program going to be island-wide?
Well, the Chief Environmental Health Officer is not here, but as he indicated, the program, the environmental health officers are in all the districts, and whatever we're doing is island-wide.
I have that question because I'd like to know the recommendations for people who have soil in the all over the communities, and of course we all recognize the issue. You all highlighted the issue, so I'm saying, what recommendations do you have for the community?
We have a plan for waste collection. We have been advising people things like wood and galvanized. I think the Environmental Health Division did make an announcement of where this can be stored temporarily, and household garbage will be collected. Unfortunately, we cannot take any further questions at this point in time. We have to wrap up. I just want to thank members of the media for being here, and also our colleagues from health for being here this morning. Any further question you have, we could take it on a one-to-one basis, but unfortunately we have to wrap this session now. I want to thank everyone again and thank our listeners for being with us this morning, and to tell them that our thoughts and prayers continue to be with them. Thank you.